Good day, dear students. My name is Isani Naura Maratza. I'm a teacher of English at Tartube Higher Agricultural College. In our previous lesson, we talked about classification of animal diseases. In today's lesson, we will talk about infectious diseases of animals. The aims of our lesson to develop people's knowledge about new theme about infectious diseases in animals, especially in livestock, and to develop speaking, reading, and listening skills. Now, students, look at the screen. Infectious diseases. Let's learn new vocabulary. Abortion, tüsüktästau. To affect, asiritu. Barn, saray, qora. Blood, qan. To contaminate, жұқтыру. Degradation, жансыздандыру. Eradication, жою, құрту. Fever, қызу. Let's read a text. Infectious diseases are those caused by infecting agent or organism. A disease can be infectious but not readily transmitted to others. There are several categories of organisms capable of infecting domestic animals. They include parasites, bacteria, and viruses. Some of these diseases are transmissible from animals to human beings. These are known as zoonoses. Examples of zoonoses are rabies and tuberculosis. Some examples of important bacterial diseases of domestic animals are shown below. Anthrax. Anthrax is caused by Brucellus anthracis and can affect all warm-blooded animals. It is highly contagious to human beings handling an infected animal, but it is not normally transmitted readily to other animals on the farm. Anthrax is usually rapidly total. Brucellosis. Brucellosis is caused by several species, including Brucella aborutes. It commonly affects cattle, sheep, goats, pigs, human beings, and causes abortion and fever. There is no effective treatment for affected animals. Human beings are normally treated with large doses of antibiotics for a very long period. Brucellosis can be effectively controlled by vaccination combined with testing and eradication. It is fairly well controlled in livestock in the USA. There is concern about it spreading into cattle from other sources, for example, buffalo. Tuberculosis. Tuberculosis is caused by several species including Mycobacterium tuberculosis. It affects mammals, birds, and reptiles. An effective treatment is available. Also, drug resistance is becoming a serious problem for human beings. Tuberculosis requires a long course of therapy. Herds are tested regularly by veterinarians, and if affected animals are found, they should be slaughtered. Meat and milk of infected animals can transmit the disease. Now, students, let's watch video about infectious disease anthrax. Then we will continue our lesson. Anthrax. Anthrax is a highly contagious and infectious soil-borne disease, a relatively large spore-forming bacteria that can infect mammals. Deer, cattle, goats, and the sheep are the main animals affected by this disease. The animal gets the disease by swallowing anthrax spores while grazing. Grazing is a method of grazing in which animals is grazing grass. The symptoms include staggering, have difficulty breathing, tremble, and the final collapse and die within a few hours. Anthrax is affected to the nose, mouth, and anus of carcasses of animals. Two ways to avoid the spread of anthrax is to isolate the unhealthy animal from the sick and monitor them carefully. Disseminate soil, bedding, unused feed, disinfect premises that may have become contaminated from dying or dead animals. Signs and symptoms of cutaneous anthrax include a raised, itchy, bumpy, resembling an insect bite that quickly develops into a painfully sore with a black center. You can also become infected by eating contaminated meat. Use appropriate personal protective equipment, including properly fitted face mask, eye protection, protective gloves. Regularly wash your hands thoroughly with soap and warm water. Avoid putting your fingers in your eyes, nose, or mouth. Now, students, let's continue our lesson. They are given you some exercises. The first exercise, complete the sentence. After reading a text previously, you must complete these 6 sentences. The next task. Scan the text to determine whether these statements are true or false, and if they are false, say why. The next. Read the description and guess what disease it is. Now, students, our today's lesson is over. Goodbye. See you next time.